So now we scan the mouth. We don't take any no more impressions, and that is a really big difference.
It's a very small machine. It takes a lot of picture at the same time, and then just taking picture of all and every single tooth, and then just put it together and make an image, digital image of a mouth.
100 pictures per second,
exactly.
Maybe. Yeah,
the exactly ball of the mouth, right?
Those are huge things, because that, number one, that makes the patient not be biting on something for a long time. It takes away human error, the experience of the patients.
The contamination on the world, we can help this situation with the technology.
Hello, welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, the patient. My wife and I are the owners of Supreme Dental Clinic. My name is Frank Navarro, and today I welcome Dr. Joel.
Hello, Frank.
I welcome Dr. Alonso, and I welcome Dr. Luis.
Hi, Frank.
Today we're going to talk a little bit about everything. So we're going to talk a little bit about the old school dental and the new school dental, because I believe that is a big concern. A lot of patients have gone to the dentist back in the day, or somebody in their family went to the dentist back in the day, and believes that everything is still the same. Now, this episode is going to be to tell our patients that is not true. We've came long ways, and we are far from what dental used to be. So who's gonna start it out? One of the first questions that we get is, what has really changed on dental when it comes to Xrays? What is a big difference in Xrays that we have from back in the day to now?
All right, but Frank, that's a good thing that we can start with, because before starting with X-rays, before we have to, even us, when we started the school, they taught us to take X-ray like the old school style, like doing the X-ray, and then we have to buy some like films, and then develop in a dark room with liquids. It takes like 15 minutes to just develop one X-ray. So it was a lot of time. Imagine here with that patient, we have to do the full mouth X-rays and like get more than 15 minutes with each one. We need like 14 or 15 X-rays in every patient.
When the clinic barely started, there was a point when I helped develop X-rays, and I remember we had a red box.
Yeah.
And we had to stick our arms on both sides.
Exactly.
And we had to put the X-ray like in 2 little cups. And then into the water thing, I believe. I'm not sure.
Yeah.
And there was a little film about this big. And then you guys would hold it up. Or there was a little light in the unit, and you guys would put it there and show it to the patient and be like, do you see that fracture right there?
Mm-hmm.
And I would be like, oh, like I could see it, you know?
Yeah.
And now what's the difference? What's the new thing now?
Huge difference. Now, the first thing is we have this digital X-rays. So there's the same size of a film, but electronic. And then you got the X-ray in like 1 second, and you can see it at the screen of the computer. I mean, right now.
Right away.
Sorry.
So you get it, you take it.
Exactly.
And you could see it.
Yep.
Yeah.
And much more definition.
You could focus on it.
Yeah, make some zoom on it, and I mean, see much more details like done before.
And what is a big factor of that? How does that help you guys out?
I mean, it helps us a lot because we can see more things. I mean, we can see, and I mean, actually, you can do zoom. We can do like put the different tissues in different colors, like bone in one color, then the tooth in a different color. If you have a decay, we can see it a different color, and then we can identify exactly the difference in between the tissues. So that's huge. I mean, and the timing of taking the X-rays, and we can do more things more precise if we do that way.
I think for the patients also, because when you guys explain to the patients, they could actually see, oh yeah, I see what you're talking about. And then you guys tap different fonts, and now the tooth is like darker, and now the white part you could be like, oh, that's where, or the grayer part,
Yes.
you could be like, that's where your cavity is, and now they could see it. Before it was just whatever you would say, they'd be like, okay, and now they're like, well, there it is. Like, I know what you're talking about. So I could see the patients. We get a lot of patients saying, oh, they don't even have this technology back at home.
Exactly.
You know, we have it on big touchscreens, so you guys can take a look at it and see exactly what's going on. What's another big thing that you think has changed, that you guys think have changed over the years that has better?
For example, the radiation.
Radiation.
Yeah, it's a minimal radiation. If you compare it with the old school, the radiation is, oh my gosh, more big. For example, you need a protector on your body, but with this technology, you don't need a protector because it's a minimal radiation.
Yeah,
It's the other very important thing.
Yeah, we see a lot of patient, and they ask, hey, why you are not using nothing to protect you? But the thing is, with this kind of sensor, is completely another history, because like Dr. Luis said, this kind of sensor use really less radiation. Actually, the cell phones use more radiation than this kind of sensor. That's crazy.
I was gonna say that. So what type of, when you guys do on the X-ray, and you guys are gonna use the digital X-ray, what do you guys put on the X-ray? What is it, like 0.8 or what is it?
Oh, like a point.
0.16
again. Point
So
point
zero-
0.10.
0.16,
Yes.
0.10.
Yes.
Exactly.
Okay. And back in the day, radiation was what? Do you remember?
Yeah.
3 or 4
Yeah.
point.
4 in indications.
Yeah.
7, 6.
Sometimes,
depends. Yes.
Yeah.
I remember it was a lead vest. We used to wear a lead vest.
Exactly.
And the patients had to wear that lead vest. And a lot of patients do ask that, where's my lead vest? And now you're like, no, this is the same as like 12 to 14 seconds on your cell phone. It's the same thing as an X-ray nowadays. So that's a big difference that came. And then you guys don't come out of the clinic glowing, you know, with all that radiation, because that was also dangerous for you guys.
Yeah.
Yes.
Exactly.
Especially for females, female dentists, that pregnancy and all that good stuff. Because a patient comes, you guys take 10 X-rays, but you guys take 50 X-rays, 100 X-rays in a day, maybe 200-300 in a week, depending on how strong the week is, maybe even more. So all that radiation was going towards you guys. Because a lot of times putting on the lead vest, taking off the lead vest, putting on the lead vest became, it wasn't something that a lot of times would be done, and now you guys don't have to worry about that.
Yeah.
So that's a huge factor.
Yes.
Welcome to Dental Facts. Did you know replacing your toothbrush after illness prevents reinfection? You heard it first at Supremedental podcast. Floss, brush, and keep smiling.
Yeah, exactly.
Let's talk about, what about technology, let's talk about crowns or veneers. What has been the big change and factor? Because I know metal porcelain was the crown to have.
I know.
It was like the best of the best back in the day. So what new things have came out? What new impressions have came out that are better for everybody?
Okay. Well, with this new technology, we have the possibilities to use better materials like zirconia crowns. Long time ago, sometimes not here in this clinic, but in another clinics here around, they are still using metal porcelain. Metal porcelain is good. is a good material, and they work for long time. But it's a combination of two materials. It's the metal, and then the top around the porcelain. So sometimes the combination of both materials, they are not completely making fusion, exactly. That's the reason now with the technology, we are using the scanner. So now we scan the mouth. We don't take any no more impressions, and that is a really big difference. It's completely another history.
Do you guys remember when you would put it on and it'd be like,
Yeah,
they would want to throw up? I think you had a patient that threw
He
up.
literally threw up.
That he threw up on his hat.
Yeah,
Remember?
yeah.
He threw up on his hat because a lot of people they call that gag
It's
reflex.
a reflex.
Exactly.
Yeah.
Gag
Reflex.
reflex. So you put it on, and then the putty would go all the way back on their
Yeah.
throat,
Yeah.
and then they would throw up or want to throw up. And I remember, and you'd be like, breathe, 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 and it was
Yes.
like, is he gonna throw up on me? Is he not? What about when they would bite you guys?
It happens a lot of times.
Oh yeah,
Because
a lot of time. Yeah. Oh my gosh.
I
my
remember
fingers.
I'd
yeah.
really be like, open, because they were biting your
Yeah.
fingers.
My God, my finger, no, please.
So I remember that. I remember being there with you guys when you guys would take that impression and you have to wait. Sometimes you guys would have to wait, like, I don't know how many minutes, depending on
6
what.
minutes, 7
Six is like
minutes.
6, 7
sometimes.
minutes.
7 minutes. Yeah.
Permanent material.
And then
yeah.
you guys would take it out. It would go like this.
Yeah.
And then you guys would see it, and you'd be good or be like,
Or yeah, it's
Oh,
a possibility.
we have
yeah.
to
To do it again.
the
repeat.
patient
To redo
will-
that, yeah.
You know, I need you to relax your jaw
Yeah.
or whatever it is. Just go ahead and retake it.
Yeah.
So that would take 6 minutes, then another 6 minutes. Then if the patient, had a gag reflex, you would have to put their chair at an angle so they would breathe better. I remember the assistants would be holding their hands, telling them to breathe,
Put some air on their faces.
air on their
Air,
faces.
yes.
And now with digital, how's the digital? How does it work? How does the digital compression work?
Okay, now it's a scan.
Yeah.
Very very new scan. Actually, it's the newer that I know. And forget about impression. Forget about gag reflex. Forget about patients can breathe or
Sticky materials.
sticky materials, all that stuff.
It's a small machine. Yeah.
Yeah, it's a very small machine.
Very
It takes a lot of picture at the same time, and then just taking picture and picture and picture
Yeah.
of all in every single tooth, and then just put it together and make an image, digital image of a mouth.
100 pictures per second.
Exactly.
Maybe. Yeah.
The exactly ball of the mouth,
Yeah.
right?
And that it's making it more
Precision.
faster and way more precise. I mean,
Yeah.
we have more because before we need to send those impressions to the laboratory. So the laboratory needs to scan those impressions to send it to the machine to do the crowns. But now we are saving a lot of steps. So the patient can move. That's the first step that we take it out. Then we can put the bucket, the tray, in a bad position, and it's another mistake that we can just take it out. And then when we send the impressions to the laboratory need to put something hard on it, like plaster or whatever.
That's in the old impressions.
And all
Yeah.
kind of impressions.
Yeah.
So now it's not. So we remove another step, like we can mess up.
Well, you guys you guys remove the human error, because then the person that would take the impressions, what if they would drop the impression?
Exactly.
And they would change it. So now George, that's on his phone right now. He'll go ahead and put a video of one of you guys scanning someone's mouth, because I know it does like a little song like.
Yeah.
How long does it take for you to scan someone's upper arch? How long?
Usually.
Upper arch?
Like
With
just
ex- with
1
ex-
minute? A couple minutes?
With experience, a good experience, probably 2 minutes, 3 minutes.
Yeah.
Or 1 minute.
Sometimes.
For a
Depends.
very experienced
1
guy,
minute.
it could be like a minute and a minute and a
Yeah.
half.
So within a minute, scans your mouth,
Yeah.
done. There's no impressions. There's no putty. There's no human error. You guys get that. Email it to the lab,
Yeah.
And the lab just put it on the machine.
and it starts working.
Yeah, in the lab, after to scan the mouth and everything, we need to take the registration of the bite
Of
using this
yeah.
sensor, the same thing.
With the same scanner.
Yeah, we can send that information by email.
Yeah.
And in seconds, the lab have all the information about the preparation, about the teeth, everything. So then they have to design in a computer the smile design and everything, the crowns, and then a machine make those crowns. So that's the reason, another thing really, really important, the seal between the crown and the natural tooth is completely perfect, because, like I say, the lab, they have all the exactly mold of the mouth. So, and also, usually for example, with the metal porcelain crowns, the laboratories need to use the hands. So it's a hands up. So
Yeah.
and sometimes the precision is not completely great.
Great, yeah.
Sometimes, but now
It's less.
a machine make the crown, so it's
Yeah.
completely It's a big
It's a big
difference.
It's
difference. Yeah.
less mistakes.
Yes.
Less mistakes.
We
Exactly.
have taking it out like steps, and at the same moment like human
errors.
and then it'll be more precise, obviously. And actually, it's like a machine doing and it's a scanner. I mean, the one that you take the picture, the thing that's gonna go to the computer when you do the crown will be exactly made it to the same size.
That's when they get to you guys just
exactly.
Exactly.
put them on, and it's just very minimal adjustments, if any
You have to
adjustments.
use minimum
Adjustments.
cement too, because they are perfectly adapted to the tooth.
Mm-hmm.
So you have even less cement and less timing at the
Less
moment
time,
when
the chair.
we deliver the crowns. We cement the crowns. So
And the other thing you can see on the computer if you have any problem with your prep.
exactly.
Yeah, you can check before send to the lab. You can check the information on the software.
Yeah,
Yeah.
exactly.
Yeah, it's very very good.
Those are huge things, because that, number one, that makes the patient not be biting on something for a long time. It takes away human error. The experience of the patient not having somebody's fingers in his mouth for a long time, and then a lot of the patients would fall asleep. I remember, and they would bite you guys. You guys' fingers are probably happy about that, that they're no longer being bitten all the time. What other things do you think have changed or revolutionized dental? Because I know the technology has gone a long ways.
For example, the contamination on the world, we can help this situation with the technology.
With technology.
Because imagine how many molds
Yeah.
we need on the week. I don't know, 50, 100. Now imagine every year. Okay.
Yeah, and we are using less material, right? Even materials for impressions, even for everything.
Yes.
So probably that's the reason we can help
The world with that.
Help the world, yeah.
That's another thing.
That's awesome. That's awesome. And tell me about, for example, all you guys have this light that you guys have in you guys carry around, like it's like,
And healt lamps.
yeah, like the headlamps, yeah. How does that? What's different between that and a normal light? Like, why do you guys use that?
Oh my
Wh-
God,
wh-
it's a big
is it just for
difference.
looks, or what's
Big
going on?
100% is different.
Yeah, that's a funny story about those lamps, because when we just start working here, so some of the old doctors had it, and the new doctors, at least when I get here, I just said I don't need it
I remember.
because
Yeah.
they're expensive.
They are
We're
expensive.
just starting and say, okay, so they are kind of expensive, and we say no, I don't think I need it. I all my life work with the normal light of a chair, and it works. And yeah, we can do the works perfectly with that lamp. But once you buy it and you start using it, so you realize like the real difference between those.
Yeah.
There's no shadow light, so you can see inside of a mouth like completely. I mean, every single spot on the tooth, every single spot on the mouth that you want to see it, you can see it very clear because of the light.
For-
So I say,
For
yeah,
example, on the preps, you need to check the termination. Is, I don't know, 1 millimeter or a 0.5 millimeter is very, very small. With the lamp, you can check perfectly everything.
Yeah.
That's why I think it's important to
Yeah, it
use
is.
the lamp.
it is.
How is that on your eyes though? Like when you guys didn't have that lamp, did you guys get like headaches? Because did you guys used to force your eyes to see better, or once you guys get the light, now you can see like, wow, that's a big difference. What if I take your guys' lights away? How does it work now? Do you,
When I do the scan, I need remove the lamp.
no, but let's say for example, right now I take away your light,
Okay.
and you're
You
gonna
want to
prep,
get it back.
you're gonna prep up a full mouth restoration. Would it be harder?
No. I don't. I think that's possible with me. I need the
Yeah,
lamp.
we are used to it
You
now.
get used to it now.
We are used to it now. If you take it out, so I'm going to say, okay, I need it to work with. When I at the beginning, I thought I
You didn't need it.
Yeah, but now I think I do.
Or sometimes we are working fillings or crowns or make the preparation, right? And it's very very specific, like like
For
light
example-
determination and everything.
Yeah.
So sometimes to be honest, sometimes I don't use the hand lamp.
Yeah.
But when I have when I see something wrong, so it's necessary. It's like you know what? Just give me the hand lamp, and I take a look again,
Yeah.
and then I can see completely what is a mistake, and
Yeah,
then
yeah.
we can make a repreparation right
But
there.
you see the difference.
You see completely the difference.
Yeah.
So
Yeah.
do you guys think that when a patient comes and sits down at, let's say at Supreme, and probably at a lot of clinics like that throughout the world, they sit down and they see a big computer and they see they're getting X-rays, and a lot of patients are looking at their X-rays while you're taking them. They're looking at them. And a lot of them say, wow, I didn't think my teeth were that bad. And then they see you guys with these headlamps, you know, and then they see you guys scanning. Do you think the patients feel more at ease? Do you think they feel more, you know what, we made the right choice, because they know that the work that's going to get done is going to be very high quality. So that's pretty much why we get all that technology.
Yeah.
Because you guys are able to work better, more efficient, and faster. Why faster? Because you don't have to take the same impression 2, 3, 4 times,
No. Yeah.
you know, and we eliminate a lot of the man error, and we let technology do its part, but we let you guys do your part, because you guys cannot be replaced with technology yet. We don't know if 10 years from now, we don't know if, you know, there's going to be robot
Get it.
dentists. But for right now, you know, technology has really changed the game, how fast things are done, how efficient things are done, and how we can eliminate the man errors. So that's huge. That's a huge difference. So anybody, you guys out there, that you had a bad experience in the past, that you guys have a gag reflex, that you guys said, you know what, I always get cavities underneath my crowns. Well, all those happen to be with it, they work with whatever they had back in the day, but now things have changed, and we have adapted, just like a lot of other clinics, just like our doctors here, and we adapted to something new, that to bring you guys the best quality possible. So
Definitely.
so with that, guys, I want to thank you guys for taking the
Thank
time to talk about that. I know that there's many other things to talk about for dental. And so thank you. I know you guys are busy. I know that we celebrated a birthday today, so you guys are probably going to eat some cake. And so thank you so much for being here.
Thank you,
Thank you, Frank.
thank you,
Thank you, Frank.
everybody.
And thank you so
everybody.
much here at Supreme Dental Podcast, where smiling starts here. Thank you so much.